Well, we've got Lindsay, who's our friendly pharmacist from Canada. Lindsay, thank you for coming back.
Thanks for having me,
Um,
John.
Regular viewers love your slots. Just for those that have missed out on the great stuff we've done already, just tell us where you are.
Yes, I'm here in British Columbia, Canada. I'm on the west coast of Canada.
Yeah.
It's obviously winter here. It's quite wet and rainy. So, and I'm about 300 kilometers from Washington, in the United States.
Yeah. So, lockdown life at the moment, Lindsay. What are you locked down? What are the restrictions? How is your daily life?
Yeah, so lockdowns in Canada have been different depending on what region of the country that you're living in. So
Mm.
right now in British Columbia, we are not officially locked down. However, for some weeks now, we have been asked not to associate indoors or outdoors with anyone outside our household. And we are allowed to go out for essentials. That's fine. It's I would not call it a lockdown. There have been other provinces like Manitoba, Ontario, Quebec that have been in more of a serious lockdown. Fortunately, because of these lockdowns and because of the restrictions, we are seeing that our case numbers are going down. Some places are looking to start lifting restrictions slowly, but at this point, life here in British Columbia is, I would say it's fairly normal as to COVID times. Not no huge lockdown, but it's quite quiet. It's quite quiet.
Good. I'm delighted the case numbers are going down. And of course, the case numbers per capita in Canada are way lower at the
Mm-hmm.
moment than the UK and the United States. And obviously, we hope it stays like that. But
Mm-hmm.
my concern is the introduction of new variants, the mutant forms in Canada.
Mm-hmm.
What is kind of the state of play as regards South Africa variant, UK variant, Brazilian variant, anything like that?
Yes, so the variants are here in Canada, and a couple of weeks ago, Teresa Tam, our Chief Medical Health Officer, she did say that there was possibly evidence of community spread of the UK variant. The
UK,
South,
yeah.
the South African variant now the UK variant has been detected in 4 provinces at this point. The South African variant, I am not sure how many provinces it has been detected in. I think it's been detected in Ontario. I know that in British Columbia, where I am, I believe we've had 3 cases of the South African variant. Now, that was very concerning because the UK variant that we found in BC, I think there's been about 6 cases, those were all linked to travel or linked to someone who had traveled. The
Sure.
South African variant is very concerning. I mean, the UK is as well, but with the South African variant, the 3 cases that they found in British Columbia were not linked to travel, nor were those cases linked to each other. And
Right.
so
Yep.
that is quite a concern. And we
So
need to get on
the
top of that.
potential for community spread there, certainly with the South African variant. Yeah.
Yeah.
And of course, the thing about these variants is they can start at a low level, be at a
Hmm.
remarkably low level for weeks or even a couple of months. And then because the growth is exponential,
Hmm.
it can just take off. I don't know if you've seen some of the reports from Portugal, for example, where that's happened. It's dramatic increases. So, I mean, I
Hmm.
think that's one to certainly keep an eye on. Is there a good sort of public awareness in Canada of the level of risk that we are talking about here?
That's a good question. I think that the awareness is coming. The federal government just imposed some more widespread travel restrictions in Canada, and those took effect as of yesterday. So air travel in Canada has been responsible for about 2%, they think, about 2% of cases, but that's quite a bit of cases once you scale that up to a large population. So what we have happening in Canada in March, as well as we have March break, which is spring break from schools, and a lot of Canadians like to travel to warm destinations during spring break. So
Yeah.
I think it's a little bit of strategic timing in that these travel restrictions are coming into effect now. So as of yesterday, all international flights are being rerouted through 4 different airports. And if you are coming into Canada from outside, you are going to have to quarantine for 14 days. But for the first part of that quarantine, you actually have to stay in what they're calling a quarantine hotel at your own expense until you have been given the results of a negative PCR test, at which point you're sent home, and then you're going to be more closely monitored during that time for adherence to the quarantine. So all airlines have suspended flights to the Caribbean and Mexico until April 1st. And there's no word on preventing interprovincial travel yet, which is a concern to me. I know that the province of Manitoba is looking at implementing something like that. The Atlantic provinces, the Maritimes, they have already had something like that in place for quite a while. My province of British Columbia recently said that they cannot restrict interprovincial travel until there's evidence of spread, which I think is unfortunate because we don't want to wait until we have a problem. So is there awareness? I think that the awareness, it's hard because there's also pandemic fatigue. And there is a population of people that, I mean, we're all tired, but there's a population of people, I think, that are just, it's very hard to get the public to adhere at this point. We're over a year now into this pandemic. So,
I mean, there's two things that you said really concern me there. One is the waiting for something to happen so they react to it.
Yes.
And because of the exponential growth that can be already there. And the 2% of cases might not be a lot, but if those 2% are overseas variants, that's potentially disastrous.
That's right. That's right.
Would you agree, Lindsay, that the way out of this pandemic is vaccination?
Definitely. I think that the problem that we're having in Canada right now is distribution and the fact that we cannot manufacture vaccines in Canada right now. But I do think that vaccination is going to get us out of this. And also just seeing people vaccinated, I think, would help people adhere to restrictions until they're able to get vaccinated. And then we can start to see our curve go down eventually, right?
Mm-hmm. Have you been vaccinated yet?
No, I haven't. In my province of British Columbia, every province has their own vaccination rollout plan. And most places are vaccinating the most vulnerable people in long-term care first, and the elderly. And so I fall fairly low on that list. According to the phased rollout plan in British Columbia, it was looking that like pharmacists may be vaccinated by April, but Canada has recently had a serious decline in our Pfizer and Moderna shipments. And that's just pushing everything further. As soon as I can get vaccinated, I will, and I will tell you.
I want to be vaccinated last month, preferably.
Oh, absolutely.
But I'm probably looking at about March, so.
Okay.
Yeah, I think a lot of people will be surprised there's no vaccine manufacturing in Canada. Is the plans to ramp that up now and to have a manufacturing capacity in Canada?
There was some talk of getting a lab going or a manufacturing plant going. That was maybe about 6 or 8 months ago. And there was a lot of money that was going to be invested. I think they were talking about $45 million or something to get something up and running. But that seems to have fallen by the wayside. And there is talk that we really need to start considering the fact that Canada needs to have their own manufacturing plant. We used to have one called the Connaught Medical Research Laboratories, where we used to produce our own insulin. And we also used to produce vaccines for different parts of the world. We even helped with the US with the polio vaccine. But I think it was in the 80s that laboratory was sold, it was privatized. And Canada hasn't done a very good job in investing in their own manufacturing capacities for vaccines. There was a member of our vaccine task force just this weekend who's calling on the government, Dr. Alan Bernstein, calling on the government to ramp up manufacturing because of these variants. We may need vaccines for several years. We may need multiple doses. And so Canada should be thinking about that. I completely agree. And this having Canada be dependent on other countries for our vaccines has really left us in a difficult spot.
Japan's much the same. I was amazed to learn there's I don't think there's any manufacturing of vaccines in Japan. It really is this internationalization that's gone on over the past sort of 50 years, really. I mean, I think this pandemic's really shown up weaknesses in that. And all advanced countries are going to need their own vaccine manufacturing capacity, and I'm sure it will happen. So I think probably lesson learned. But in the meantime, of course, we're suffering the delay, and hopefully Canada will be authorising the Oxford AstraZeneca soon. Have you heard anything about that?
That's supposed to happen within the next 2 weeks.
Good,
so
good.
I'm very hopeful about that one. I like that vaccine. It's cheap, and they're able to manufacture it at high volumes. So
and you can carry it around in your cool box with just a couple of ice blocks. So
that's right.
Yeah. Now, in the meantime, quite a lot of the gap needs to be plugged with testing, so we can have more targeted isolation. Well, what's happening with the testing? What's going on testing-wise in Canada?
One of the things that I think that we have really missed out on in Canada, and it is coming, but it's coming very slowly, is the use of rapid tests in Canada. So
like the lateral flow testing and things.
Yes. So we have currently over 14 million rapid tests in Canada, but we have millions of them just sitting in warehouses. It seems like our government hasn't really known where to use them or how to use them. I'm not saying they're not being used. They are starting to be used, and they are going to be implemented at airports. I think New Brunswick has done a great job in setting up even just testing for even asymptomatic people. Some of the barriers have been that they're not quite as accurate as the PCR tests, but that doesn't mean that we should not use them. Every tool we have, I think, needs to be used. And another one of the barriers is labor. We have so many people that are testing people with the PCR with the nasopharyngeal swabs. We have people who are contact tracing and just finding people to be able to deliver the rapid tests and be trained. And I believe it was New Brunswick, they actually trained volunteers. These people don't even have medical experience. They're able to administer these tests. And every tool we have is valued. And one of the terrible stories of this pandemic in Canada and around the world has been the situation in long-term care. And these tests, if we were using them more widely in long-term care, they could have saved a lot of lives. And I think they could also be used to help screen for essential visitors, so people could actually have visitors in long-term care.
Mind you, for visitors long-term care, yes. I was thinking you meant the country. It's like if you want to go to Canada or Australia now, you've got to be fairly rich, because you've got to pay for 14 weeks hotel accommodation, 14 days, which is quite expensive. But for visitors to care homes, yes, I think that's a very good point. Do you know, in the UK, we have like national screening for antigen levels and for antibody levels. Is there any equivalent to that in Canada, or is it all kind of delegated down to state level or province level?
We do have a little bit of that. I saw that there was some available for private testing, and it was about $80 to $100 per person. I don't think that has been done on a wide scale in public health at this point. That's all I know about that at this point. I don't think it's been widely used.
Yeah. Now, Denmark is currently doing genomic testing on everyone, like 100% of people.
Amazing.
Who test positive. In the UK, I think we're probably getting done for a couple 100,000 genomic tests now. In the United States, the level of testing is 0.3% of total positive cases. I mean, what is the genomic sort of technology testing in Canada?
There is. I think that we have not been doing enough of it. I know that the province of British Columbia, I don't have percentages, but I know that we've done about 11,000 of our tests have gone through the genomic sequencing. Ontario is also ramping up their genomic testing. So it's coming, but it needs to happen very quickly. We are in the war of the variants right now. So
you see genomic testing of being of increasing importance over the next sort of 6 months.
Oh, definitely. Yes. It's one of the tools we have, and I know that it takes about 2 weeks to get the results from this as well, right? Yeah. So it's a little bit there's a bit of a time lag there, so that gives us even more need to be always on top of this and be sequencing a higher percentage.
Yeah. And I know we criticise it for not being too much, but it still amazes me. I remember waiting for years and years for the Human Genome Project to be completed. All this genomic
Mhm.
stuff is actually quite recent, so
I remember as well, yes.
it is really quite sophisticated biology that's being done pretty routinely now. So,
It is. It is.
if this pandemic had occurred 10 years ago, I think we could have been in a lot of trouble.
Yes. Yes. Could
Yeah.
be worse.
Yeah. Did I ask that now, political wise? I mean, we don't like to politicize things on this channel, but was there some politicians got into trouble recently in Canada for were they jetting around the place or saying do as we say, not do as I do?
Yes, unfortunately, I'm sad to report that there was quite a bit of that came out in the weeks following Christmas. We started to hear about different politicians that had decided that maybe non-essential travel did not apply to them, and they had gone to some sunny destinations. And it's very hard when you have a public who is already going through pandemic fatigue, and you're asking a lot of them, and then we see these people who are supposed to be leaders of our nation traveling. And so there have been some resignations, some have not resigned, but there was quite a bit of outcry as it became known that many had thought that the rules did not apply to them. It was very unfortunate. Mm-hmm.
And I think we've seen this in every country. We've seen this to some extent in my country as well. There was a senior medical officer in Scotland had to resign for unnecessary travel. It really is quite bemusing. Well, firstly, it's bemusing that they think they'd get away with it, but it's also bemusing that there would, people in these senior positions, you would think they were, patriots, really in favour of doing the best for their country, and then this comes out. It really is quite.
It's appalling.
Well, it's very disillusioning, isn't it? You think, what the heck? It's yeah. So you mentioned COVID fatigue there, Lindsay. I mean, what sort of adverse effects is this having on people in Canada? I know in the UK a lot of people are finding this difficult, but what mental health situation like in Canada? Are the problems? Is the difficulties?
Yes. So every winter, even normal winters in Canada, many people suffer from anxiety and depression. Seasonal affective disorder is an issue here always, and it's very dark, and it's a tough winter. And so in COVID-19, we are definitely seeing an increase in anxiety, increases in depression. More people are taking medications for depression and anxiety. I participated in a lecture that was online, and I'll give your viewers the link because anyone
always send the links. Yeah.
Yes, and Ottawa Public Health, they gave a very, very easy to understand, very good lecture about mental health and how to take care of yourself during the pandemic. And one of the things that they noted is that self-care is very important, but also care of others. People who were able to show that they showed some kind of care for others, they reported a better sense of well-being. And I thought that was interesting. And then yesterday, I came across a rather disturbing report from the Children's Hospital of Eastern Ontario. So this hospital is reporting drastic increases in injuries to infants, including shaken baby syndrome, bleeding around the brain, and broken bones. And this is very devastating, very difficult information to hear. They are saying that the doctor that is reporting this said that she's not seen this in her 16 years of medical practice. And so clearly these restrictions and just the stress of a pandemic are having widespread effects.
I mean, this is just appalling. We're talking about lifelong brain damage here to children, aren't we? I mean, this is so distressing.
That's right.
It really is.
And there are ways that you can reach out to those, phone calls, online. There are different things that you could do to reach out to those that are in your community and in your social circle. And if we can support each other, often we don't know what's going on inside the homes of people, but if we can show even a little bit of support, I think that it could help, and the effects of that help could be widespread. So.
Absolutely. So, I mean, if you know someone, especially with young children at home, just give them a ring and just give them some impression that you understand how difficult this is.
Yes, it's been very
or anyone. Just let anyone know how it's difficult. And if you're watching this video and you are finding things difficult, for goodness sake, let someone know.
That's right.
tell someone. Let's get. Do you get depressed? Do you get anxious? I certainly do. Why would I want to pretend I don't? This is a universal phenomenon, and that's. Yeah, no, that is seriously bad news. That is happening, and the point is this will be happening in other places. It's just that Canada's got very good surveillance for occurrence of this sort of disturbing, these sort of disturbing injuries. Right, next few months, Lindsay, you take your best guess.
I am hoping that in the next few months, Canada will be able to get more vaccine. I'm hoping that our vaccine supply is going to be a bit more predictable. I'm hoping that. And when that happens, people will start to see that there is a light at the end of the tunnel, more people being vaccinated, cases will go down. In the spring, we will start to get better weather, and that has a positive effect on the virus as well. But we really need to hang tight. These variants are a very serious concern, and I'm not sure that everyone is realizing that. It's coming slowly, as I said, but now is not the time to ease up. Now is not the time to let our guard down. We don't have to live in fear, but we know what to do. We know what to do to contain this virus, and the variants are no different, although they can be more contagious. So now more than ever, we need to wear our masks. We need to social distance. We need to restrict our social circles and follow public health guidance now more than ever. And I am hopeful for a better spring 2021 than we are having winter right now. We just have a couple more months to really stick it out. Yeah.
No, I agree. And make that phone call and do something silly. If it involves shouting through your next door neighbor's window and looking a bit silly, then do it. Just
or write a letter or
communicate.
There's things that we can do, and even the littlest action can go a really long ways to someone who is feeling lonely, isolated, and very depressed at the moment. The littlest thing can make a huge difference.
Yeah. So everyone watching has the power to make the difference to someone.
Absolutely.
Yeah. Lindsay, great, always great to hear about Canada. Fascinating to sort of compare and contrast Canada and the UK.
Yeah.
The US and other countries, different countries' approaches, what's happening. Quite striking though that so many of the problems are of course shared.
Similar.
And, but it's good to hear the way that that's happening in Canada. Great, thank you as always.
Thank you very much,
Your reports are always well received, and
let's chat with you.
Yeah. Well, God willing, we'll speak again.
Yes. Take care.
Thanks, Lindsay.